You're watching continuing coverage of World Healthcare Congress 2012, and I'm very pleased to welcome to the studio Tom Strauss, CEO of Summa Health System from Ohio. Thank you so much for being with us.
Yeah, you're very welcome, Mabel. It's good to meet you and be here at the Congress.
Well, it sounds like Summa is well positioned to go forward as an integrated health system to weather any sort of changes in the healthcare laws. Is that correct?
Yeah, we, as you know, we have 8 hospitals. We have a pretty significant multi-specialty physician corporation of about 270 physicians, and we have our own health plan. So we've had 20 years of history in population health and population management, where we have about 25,000 Medicare Advantage lives. And so we've used those lives to be the pilot towards our accountable care journey. And about 2 years ago, preparing for healthcare reform, we started to evaluate what we could do around our ACO development and took 11,000 of those Medicare Advantage lives, put them into an ACO we call the New Health Collaborative, created a structure that's a taxable nonprofit, and now has 9 board members, 7 are physicians, and 9 of those are independent physicians.
Okay.
So running 4 large primary care practices that are independent of our employee group.
Okay.
So this journey we're on is actually working very well, despite what's going to happen with healthcare reform and despite the fact that some of them are independent practices.
Are these ACOs going to have to look any different depending on what people decide in June will have to change?
Well, it really depends what's happening. The beauty of where we are today is that we already have a Medicare Advantage. Our Medicare Advantage, called Summa Care, is the highest rated in the state. We're 4.5 stars for Medicare. And so we already are capitated for that. So we can create these new models, these shared savings incentives with our physicians and hospitals that allow us to begin to transform healthcare. And to give you some numbers, the first 11,000 members we have in this pilot, we started January of 11 until January of 12 through 3 quarters. It looks like we've reduced costs by 8%. And generated significant savings that are now being shared back, 60% to the ACO, 40% for our health plan, because our health plan takes the downside risk on that. And we're seeing really transformation. Our readmission rate on CHF on those lives are now down at 10% within 30 days, with the national average being 24%. And with the savings on $100 million of spend, of close to $8.5 million.
Well, how did you get to this point?
Well, we had 100 people across our system looking at the care models, looking at the IT systems that are needed, looking at the distribution network, and then a little bit about financial shared savings models. And we've been at it now for 1.5 years, and it's working. And the next phase for us is to bring our employees in there.
Okay.
Those employees will start it in January of this year. We have some interesting incentives to keep our employees healthy.
Like what?
We give points based on their body mass index, their cholesterol levels, their blood pressure, and their, what was the last piece? I don't remember. But
so a pretty involved system.
Wellness that allows them to have points, and once they get points, they get discounts on their employee health plan. The final phase then is a Medicare shared savings product that we're going to be applying for. We applied for, and we hope to hear for July 1st.
Do you think that folks have really embraced these new programs and changes, and have they also been vocal about what else they might need going forward?
Well, you know, I think people realize that what we have in healthcare in this country is unsustainable. When we're spending $2.5 trillion on healthcare.
We did say that in 1998 that we were at 10%, and we just kept going up.
We're at 17.6% of GDP. Any other industrialized nation in the world is, 9 or 10%. In fact, Singapore, I just heard there was somebody from Singapore saying it's about 4%. So when you have that, plus the unfunded requirements for Medicare, as an example, the unfunded mandate that's out there to cover that care is about $35 trillion, double the amount of the GDP of the U.S. So we got to do something different, and we believe fundamentally that transforming healthcare away from sick care to healthcare is the way to go. And so we think population health, population management, and the beauty at Summa is that we're taking our 20 years of experience and helping other nonprofit health systems now on that journey. So in our own market, University Hospitals Health System in Cleveland, we're managing their employee health plan. We're sharing best practice around our ACO, and our goal is to continue to move in that direction. We're doing that in Vermont, we're doing that in Florida, we're doing that in Tennessee.
Fantastic. Great. Well, thank you so much for sharing your experiences with us.
It was nice talking to you, Mabel. Thank you.
I'm Mabel Jung. Thanks for watching.